CNA Practice Test Part 3, 200 questions with explained answers. Question 1. What is the clinical term for sugar in the urine? Option A, hematuria. Option B, glucosuria or glycosuria. Option C, proteinuria. Option D, pyuria. The correct answer is option B, glucosuria or glycosuria. Explanation. Sugar in the urine is a common finding in residents with uncontrolled diabetes. Question 2. What are reagent strips used for in urine testing? Option A, to measure the amount of urine output. Option B, to measure substances like sugar or ketones in the urine. Option C, to clean the specimen container. Option D, to filter out bacteria from the urine. The correct answer is option B, to measure substances like sugar or ketones in the urine. Explanation. The strips change color when they react with specific chemicals in the urine. Question 3. When is the best time to collect a sputum specimen? Option A, right before bedtime. Option B, first thing in the morning. Option C, immediately after a meal. Option D, in the middle of the night. The correct answer is option B, first thing in the morning. Explanation. Sputum is more concentrated and easier to expectorate after sleeping. Question 4. What is aphasia? Option A, the loss of the ability to walk. Option B, the loss of the ability to speak or understand language. Option C, a type of severe skin rash. Option D, the inability to swallow food. The correct answer is option B, the loss of the ability to speak or understand language. Explanation. Aphasia is common after a stroke or in advanced dementia. Question 5. What is acquired immunodeficiency syndrome caused by? Option A, a bacterial infection. Option B, the human immunodeficiency virus. Option C, aging. Option D, poor nutrition. The correct answer is option B, the human immunodeficiency virus. Explanation. The human immunodeficiency virus attacks the body's immune system. Question 6. What is the final outcome of Alzheimer's disease? Option A, it is eventually cured with surgery. Option B, it always ends in death. Option C, the person regains their memory over time. Option D, it only affects the ability to walk. The correct answer is option B, it always ends in death. Explanation. Alzheimer's is a progressive, terminal brain disease. Question 7. What happens to a person's level of consciousness during shock? Option A, they become very energetic. Option B, they may become confused or lose consciousness. Option C, they have no change in consciousness. Option D, they become very happy. The correct answer is option B, they may become confused or lose consciousness. Explanation. Shock prevents the brain from receiving enough oxygenated blood. Question 8. In the FAST acronym for strokes, what does the letter F stand for? Option A, fever. Option B, facial drooping. Option C, fainting. Option D, feet. The correct answer is option B, facial drooping. Explanation. Checking if one side of the face sags is a key way to identify a stroke. Question 9. In the FAST acronym for strokes, what does the letter A stand for? Option A, appetite. Option B, arms and whether one will not raise. Option C, aches and pains. Option D, ambulating. The correct answer is option B, arms and whether one will not raise. Explanation. Weakness in one arm is a common sign of a cerebrovascular accident. Question 10. In the FAST acronym for strokes, what does the letter S stand for? Option A, sleeping. Option B, slurred language or speech. Option C, sweating. Option D, sensation. The correct answer is option B, slurred language or speech. Explanation. Difficulty speaking or understanding others can indicate a brain injury from a stroke. Question 11. In the FAST acronym for strokes, what does the letter T stand for? Option A, temperature. Option B, time is of the essence. Option C, touch. Option D, taste. The correct answer is option B, time is of the essence. Explanation. Rapid medical treatment is critical to minimize permanent brain damage from a stroke. Question 12. Where inside the lungs does the exchange of oxygen and carbon dioxide happen? Option A, the trachea. Option B, the alveoli. Option C, the bronchi. Option D, the pleura. The correct answer is option B, the alveoli. Explanation. The alveoli are tiny air sacs where gases pass into and out of the blood. Question 13. Why is there a small hole at the bottom of an anti-embolism stocking? Option A, to make it easier to pull on. Option B, to check the circulation in the toes. Option C, to allow the resident to wiggle their toes. Option D, to save on material costs. The correct answer is option B, to check the circulation in the toes. Explanation. The hole allows staff to see if the toes are warm and have a pink color. Question 14. Which nervous system is responsible for the fight or flight response? Option A, the parasympathetic nervous system. Option B, the sympathetic nervous system. Option C, the central nervous system. Option D, the digestive system. The correct answer is option B, the sympathetic nervous system. Explanation. The sympathetic system increases heart rate and blood pressure during stress. Question 15. What is the term for black, dead tissue that may be found in a wound? Option A, slough. Option B, eschar. Option C, serum. Option D, pus. The correct answer is option B, eschar. Explanation. Eschar is thick and leathery and must be removed for a wound to heal. Question 16. Where is the most common site for a pressure ulcer to develop? Option A, the ear. Option B, the sacrum. Option C, the knee. Option D, the elbow. The correct answer is option B, the sacrum. Explanation. The sacrum bears significant weight when a resident is lying in bed. Question 17. What does it mean if a resident is sedentary? Option A, they are very active and walk a lot. Option B, they are barely moving or stay in one place. Option C, they are very talkative. Option D, they are extremely hungry. The correct answer is option B, they are barely moving or stay in one place. Explanation. Sedentary lifestyles increase the risk of pressure sores and blood clots. Question 18. Where on a manual bed should a Foley drainage bag be hung? Option A, on the side rail. Option B, on the bed frame. Option C, on the footboard. Option D, on the headboard. The correct answer is option B, on the bed frame. Explanation. Hanging the bag on the frame ensures it does not pull when rails are moved. Question 19. Separating a person from others against his or her will is an example of what? Option A, standard care. Option B, involuntary seclusion. Option C, proper isolation. Option D, restorative nursing. The correct answer is option B, involuntary seclusion. Explanation. Involuntary seclusion is a form of abuse and is strictly prohibited. Question 20. What units is blood pressure measured in? Option A, milliliters. Option B, millimeters of mercury. Option C, degrees Fahrenheit. Option D, pounds and ounces. The correct answer is option B, millimeters of mercury. Explanation. Blood pressure readings are recorded as a ratio of systolic over diastolic pressure. Question 21. How often should you check a resident's skin when they have a hot or cold pack applied? Option A, once per shift. Option B, every 5 minutes. Option C, every hour. Option D, only when the pack is removed. The correct answer is option B, every 5 minutes. Explanation. Frequent checks prevent burns or tissue damage from extreme temperatures. Question 22. What is a bland diet? Option A, a diet that is high in calories and fat. Option B, a diet with no spicy or irritating foods. Option C, a diet that consists only of liquid. Option D, a diet that is served very cold. The correct answer is option B, a diet with no spicy or irritating foods. Explanation. Bland diets are used for residents with digestive issues or ulcers. Question 23. Which blood vessels always flow back toward the heart? Option A, arteries. Option B, veins. Option C, arterioles. Option D, capillaries. The correct answer is option B, veins. Explanation. Veins carry deoxygenated blood and waste products back to the heart. Question 24. What does the clinical abbreviation ABD stand for? Option A, abdomen. Option B, abduction. Option C, above bed device. Option D, absence of breathing. The correct answer is option A, abdomen. Explanation. ABD is the standard medical abbreviation for the abdomen. Question 25. What does the abbreviation AC stand for in medical charting? Option A, after meals. Option B, before meals. Option C, at bedtime. Option D, as desired. The correct answer is option B, before meals. Explanation. AC stands for anti-SIBUM, which means before meals. Question 26. What does the abbreviation ADL stand for? Option A, advanced daily living. Option B, activities of daily living. Option C, assisted daily living. Option D, average daily limits. The correct answer is option B, activities of daily living. Explanation. Activities of daily living include basic self-care tasks like bathing, dressing, and eating. Question 27. What does the term ad lib mean when written in a resident's care plan? Option A, as desired. Option B, at bedtime. Option C, after lunch. Option D, as tolerated. The correct answer is option A, as desired. Explanation. Ad lib is short for ad libitum, meaning the resident can perform the activity as they wish. Question 28. What does the abbreviation AIDS stand for? Option A, acute immune deficiency syndrome. Option B, acquired immunodeficiency syndrome. Option C, acquired immune disease state. Option D, active immune deficiency symptoms. The correct answer is option B, acquired immunodeficiency syndrome. Explanation: acquired immunodeficiency syndrome is a condition caused by the human immunodeficiency virus. Question 29. What does the abbreviation AKA stand for in surgical terms? Option A, also known as. Option B, above the knee amputation. Option C, acute kidney ailment. Option D, active knee alignment. The correct answer is option B, above the knee amputation. Explanation: an above the knee amputation is a surgical procedure to remove the leg above the knee joint. Question 30. What does the abbreviation AM stand for? Option A, after meals. Option B, in the morning. Option C, as measured. Option D, after midnight. The correct answer is option B, in the morning. Explanation: AM refers to the morning hours before noon. Question 31. What does the medical abbreviation AMB stand for? Option A, ambulance. Option B, ambulate or walk. Option C, ambidextrous. Option D, ambient temperature. The correct answer is option B, ambulate or walk. Explanation: ambulation is the clinical term for walking. Question 32. What does the abbreviation AMT stand for in documentation? Option A, amount. Option B, amputate. Option C, ambulate. Option D, ammonia. The correct answer is option A, amount. Explanation: amount is used to document the quantity of intake, output, or other measurements. Question 33. What does the abbreviation AP stand for in relation to a pulse? Option A, average pulse. Option B, apical. Option C, after meals. Option D, as prescribed. The correct answer is option B, apical. Explanation: an apical pulse is taken by listening to the heart directly with a stethoscope. Question 34. What does the abbreviation BID stand for in medical timing? Option A, once a day. Option B, twice a day. Option C, 3 times a day. Option D, 4 times a day. The correct answer is option B, twice a day. Explanation: the abbreviation comes from the Latin bis in die, meaning twice a day. Question 35. What does the abbreviation B stand for in radiology? Option A, before eating. Option B, barium enema. Option C, bowel elimination. Option D, basic exam. The correct answer is option B, barium enema. Explanation: a barium enema is an X-ray exam that can detect changes or abnormalities in the large intestine. Question 36. What does the abbreviation C with a line over it stand for? Option A, with. Option B, without. Option C, clean. Option D, caution. The correct answer is option A, with. Explanation: the symbol is derived from the Latin word cum, meaning with. Question 37. What does the abbreviation C stand for in temperature measurement? Option A, clean. Option B, centigrade or Celsius. Option C, caution. Option D, cold. The correct answer is option B, centigrade or Celsius. Explanation: Celsius is a scale of temperature where water freezes at 0 degrees. Question 38. What does the abbreviation CA stand for in medical terms? Option A, cardiac arrest. Option B, cancer. Option C, calcium. Option D, clean area. The correct answer is option B, cancer. Explanation: CA is a common clinical shorthand for cancer. Question 39. What does the abbreviation CABG stand for? Option A, cardiac area blood group. Option B, coronary artery bypass graft. Option C, common arterial blood group. Option D, coronary action blood gauge. The correct answer is option B, coronary artery bypass graft. Explanation: a coronary artery bypass graft is a surgery that improves blood flow to the heart. Question 40. What does the abbreviation CAL stand for? Option A, calcium. Option B, calories. Option C, calculated. Option D, call light. The correct answer is option B, calories. Explanation: calories are a measure of the energy provided by food. Question 41. What does the abbreviation CATH stand for? Option A, catheter. Option B, cathedral. Option C, calculated. Option D, caution. The correct answer is option A, catheter. Explanation: a catheter is a flexible tube used to drain fluid from or inject fluid into the body. Question 42. What does the abbreviation CBC stand for? Option A, complete bed care. Option B, complete blood count. Option C, common blood cells. Option D, cardiac blood count. The correct answer is option B, complete blood count. Explanation: a complete blood count is a blood test used to evaluate overall health and detect disorders. Question 43. What does the abbreviation CBR stand for? Option A, complete blood report. Option B, complete bed rest. Option C, common body reflex. Option D, cardiac breath rate. The correct answer is option B, complete bed rest. Explanation. Complete bed rest means the resident must stay in bed at all times. Question 44. What does the abbreviation CDC stand for? Option A, Centers for Disease Control and Prevention. Option B, Certified Disease Center. Option C, Common Disease Control. Option D, Community Dental Care. The correct answer is option A, Centers for Disease Control and Prevention. Explanation. The Centers for Disease Control and Prevention is the national public health agency of the United States. Question 45. What does the abbreviation CNA stand for? Option A, Certified Nursing Assistant. Option B, Clinical Nursing Assistant. Option C, Common Nurse Aide. Option D, Certified Nurse Associate. The correct answer is option A, Certified Nursing Assistant. Explanation. A certified nursing assistant provides basic care and assists residents with daily activities. Question 46. What does the abbreviation CO stand for? Option A, Clean Only. Option B, Complains of. Option C, Condition of. Option D, Care of. The correct answer is option B, Complains of. Explanation. This is used to document a resident's subjective reports of pain or discomfort. Question 47. What does the abbreviation CPR stand for? Option A, Common Patient Recovery. Option B, Cardiopulmonary Resuscitation. Option C, Cardiac Pulse Rate. Option D, Clinical Patient Report. The correct answer is option B, Cardiopulmonary Resuscitation. Explanation. Cardiopulmonary resuscitation is an emergency procedure that combines chest compressions and rescue breathing. Question 48. What does the abbreviation CNS stand for? Option A, Common Nursing Staff. Option B, Central Nervous System. Option C, Clinical Nurse Supervisor. Option D, Cardiac Nerve System. The correct answer is option B, Central Nervous System. Explanation. The central nervous system consists of the brain and the spinal cord. Question 49. What does the abbreviation CS stand for? Option A, Common Sense. Option B, Central Service or Central Supply. Option C, Clinical Supervisor. Option D, Cardiac Surgery. The correct answer is option B, Central Service or Central Supply. Explanation. Central Supply is the department that provides medical and surgical supplies. Question 50. What does the abbreviation DOE stand for? Option A, Date of Entry. Option B, Dyspnea on Exertion. Option C, Daily Oral Exam. Option D, Dietary Output Entry. The correct answer is option B, Dyspnea on Exertion. Explanation. Dyspnea on exertion means difficulty breathing during physical activity. Question 51. What does the abbreviation DON stand for? Option A, Daily Observation Note. Option B, Director of Nursing. Option C, Department of Nutrition. Option D, Director of Nutrition. The correct answer is option B, Director of Nursing. Explanation. The Director of Nursing is the registered nurse in charge of the entire nursing department. Question 52. What does the abbreviation DRSG stand for? Option A, Dressing. Option B, Dosage. Option C, Drainage. Option D, Driving. The correct answer is option A, Dressing. Explanation. A dressing is a protective covering applied to a wound. Question 53. What does the abbreviation DX stand for? Option A, Daily Exercise. Option B, Diagnosis. Option C, Dose. Option D, Drainage. The correct answer is option B, Diagnosis. Explanation. Diagnosis is the identification of a medical condition or disease. Question 54. What does the abbreviation ECG or EKG stand for? Option A, Emergency Cardiac Group. Option B, Electrocardiogram. Option C, Electronic Cardiac Gauge. Option D, Emergency Kidney Group. The correct answer is option B, Electrocardiogram. Explanation. An electrocardiogram is a test that records the electrical activity of the heart. Question 55. What does the abbreviation EEG stand for? Option A, Emergency Eye Group. Option B, Electroencephalogram. Option C, Electronic Ear Gauge. Option D, Emergency Ear Group. The correct answer is option B, Electroencephalogram. Explanation. An electroencephalogram is a test that records the electrical activity of the brain. Question 56. What does the abbreviation ENT stand for? Option A, Emergency Ear and Nose Team. Option B, Eyes, Ears, Nose, and Throat. Option C, External Ear and Nose Treatment. Option D, Emergency Eye and Nose Treatment. The correct answer is option B, Eyes, Ears, Nose, and Throat. Explanation. ENT refers to the specialized area of medicine covering those four parts of the head. Question 57. What does the abbreviation ER stand for? Option A, Eating Room. Option B, Emergency Room. Option C, Exam Room. Option D, Exercise Room. The correct answer is option B, emergency room. Explanation. The emergency room is the department of a hospital that provides immediate treatment. Question 58. What does the abbreviation F stand for in temperature? Option A, fluid. Option B, Fahrenheit. Option C, fast. Option D, feet. The correct answer is option B, Fahrenheit. Explanation. Fahrenheit is a temperature scale where water freezes at 32 degrees. Question 59. What does the abbreviation FBS stand for? Option A, fluid balance sheet. Option B, fasting blood sugar. Option C, fast blood study. Option D, final body survey. The correct answer is option B, fasting blood sugar. Explanation. Fasting blood sugar is a test that measures the amount of sugar in the blood after an overnight fast. Question 60. What does the abbreviation FL stand for? Option A, flashlight. Option B, fluid. Option C, final. Option D, floor. The correct answer is option B, fluid. Explanation. Fluid refers to any liquid substance. Question 61. What does the abbreviation FX stand for? Option A, function. Option B, fracture. Option C, friction. Option D, fix. The correct answer is option B, fracture. Explanation. Fracture is the medical term for a broken bone. Question 62. What does the abbreviation FUO stand for? Option A, final urine output. Option B, fever of unknown origin. Option C, fast urinary output. Option D, frequent urinary output. The correct answer is option B, fever of unknown origin. Explanation. This term is used when a resident has a fever but the cause is not yet identified. Question 63. What does the abbreviation GAL stand for? Option A, gallbladder. Option B, gallon. Option C, gauge. Option D, goal. The correct answer is option B, gallon. Explanation. A gallon is a unit of liquid capacity equal to 4 quarts. Question 64. What does the abbreviation GB stand for? Option A, gastric bypass. Option B, gallbladder. Option C, goal balance. Option D, gauge board. The correct answer is option B, gallbladder. Explanation. The gallbladder is a small organ that stores bile produced by the liver. Question 65. What does the abbreviation GU stand for? Option A, general use. Option B, genitourinary. Option C, goal unit. Option D, gastric ulcer. The correct answer is option B, genitourinary. Explanation. Genitourinary refers to the organs of the reproductive and urinary systems. Question 66. What does the abbreviation H or HR stand for? Option A, high. Option B, hour. Option C, head. Option D, health. The correct answer is option B, hour. Explanation. Hour is a unit of time equal to 60 minutes. Question 67. What does the chemical abbreviation H2O stand for? Option A, hydrogen. Option B, water. Option C, heat. Option D, humidity. The correct answer is option B, water. Explanation. H2O is the chemical symbol for water. Question 68. What does the abbreviation HIV stand for? Option A, health intake value. Option B, human immunodeficiency virus. Option C, high immune value. Option D, human infectious virus. The correct answer is option B, human immunodeficiency virus. Explanation. Human immunodeficiency virus is the virus that causes AIDS. Question 69. What does the abbreviation HT stand for? Option A, heart. Option B, height. Option C, heat. Option D, high. The correct answer is option B, height. Explanation. Height is the measurement of someone from head to foot. Question 70. What does the abbreviation HX stand for? Option A, height. Option B, history. Option C, heat. Option D, heart. The correct answer is option B, history. Explanation. History refers to a resident's past medical events and conditions. Question 71. What does the abbreviation L stand for on a medical chart? Option A, large. Option B, left. Option C, leader. Option D, low. The correct answer is option B, left. Explanation. This is used to denote the left side of the body or a specific limb. Question 72. What does the abbreviation LAB stand for? Option A, label. Option B, laboratory. Option C, lober. Option D, lower. The correct answer is option B, laboratory. Explanation. A laboratory is a place where medical tests are performed on specimens. Question 73. What does the abbreviation LB stand for? Option A, lower body. Option B, pound. Option C, lober. Option D, lab. The correct answer is option B, pound. Explanation. The pound is a unit of weight equal to 16 ounces. Question 74. What does the abbreviation LIQ stand for? Option A, light. Option B, liquid. Option C, limited. Option D, lower. The correct answer is option B, liquid. Explanation. Liquid refers to a fluid substance. Question 75. What does the abbreviation LLQ stand for? Option A, lower left quadrant. Option B, left lower quadrant. Option C, lower level quantity. Option D, left lower quantity. The correct answer is option B, left lower quadrant. Explanation. The left lower quadrant is a specific area of the abdomen. Question 76. What does the abbreviation HA stand for in medical shorthand? Option A, heart attack. Option B, headache. Option C, health assessment. Option D, high anxiety. The correct answer is option B, headache. Explanation. Headache is pain in any region of the head. Question 77. What does the abbreviation NV stand for? Option A, next visit. Option B, nausea and vomiting. Option C, normal value. Option D, nerve value. The correct answer is option B, nausea and vomiting. Explanation. Nausea and vomiting are common gastrointestinal symptoms. Question 78. What does the abbreviation PX stand for in some shorthand? Option A, pounds. Option B, stomach pain. Option C, pulse. Option D, position. The correct answer is option B, stomach pain. Explanation. This shorthand is sometimes used to indicate abdominal or stomach pain. Question 79. How many cubic centimeters are in 1 ounce? Option A, 10 cubic centimeters. Option B, 30 cubic centimeters. Option C, 60 cubic centimeters. Option D, 100 cubic centimeters. The correct answer is option B, 30 cubic centimeters. Explanation. 1 fluid ounce is equal to approximately 30 cubic centimeters or milliliters. Question 80. What does the abbreviation LOC stand for? Option A, left of center. Option B, level of consciousness. Option C, loss of contact. Option D, line of care. The correct answer is option B, level of consciousness. Explanation. Level of consciousness is a measurement of a person's arousability and responsiveness. Question 81. What does the abbreviation LPN stand for? Option A, licensed patient nurse. Option B, licensed practical nurse. Option C, licensed professional nurse. Option D, local practical nurse. The correct answer is option B, licensed practical nurse. Explanation. A licensed practical nurse provides basic medical care under the supervision of a registered nurse. Question 82. What does the abbreviation LT stand for? Option A, light. Option B, left. Option C, lower. Option D, long term. The correct answer is option B, left. Explanation. This is a common shorthand for the left side. Question 83. What does the abbreviation LVN stand for? Option A, licensed vital nurse. Option B, licensed vocational nurse. Option C, licensed value nurse. Option D, local vocational nurse. The correct answer is option B, licensed vocational nurse. Explanation. Licensed vocational nurse is the title used for an LPN in certain states like California and Texas. Question 84. What does the abbreviation LUQ stand for? Option A, lower upper quantity. Option B, left upper quadrant. Option C, level upper quadrant. Option D, light upper quadrant. The correct answer is option B, left upper quadrant. Explanation. The left upper quadrant is a specific area of the abdomen. Question 85. What does the abbreviation MED stand for? Option A, medical. Option B, medications. Option C, medium. Option D, measure. The correct answer is option B, medications. Explanation. Medications are drugs used to treat or prevent disease. Question 86. What does the abbreviation MID-NOC stand for? Option A, middle note. Option B, midnight. Option C, middle night. Option D, midnight observation. The correct answer is option B, midnight. Explanation. Midnight refers to 12 o'clock at night. Question 87. What does the abbreviation MIN stand for? Option A, minimum. Option B, minute. Option C, minor. Option D, measure. The correct answer is option B, minute. Explanation. A minute is a unit of time equal to 60 seconds. Question 88. What does the abbreviation NA stand for? Option A, not applicable. Option B, nursing assistant. Option C, normal action. Option D, normal assessment. The correct answer is option B, nursing assistant. Explanation. A nursing assistant provides basic care to residents under the supervision of a nurse. Question 89. What does the abbreviation NOC stand for? Option A, notice. Option B, night. Option C, normal. Option D, no change. The correct answer is option B, night. Explanation. The abbreviation comes from the Latin noct, meaning at night. Question 90. What does the abbreviation NPO stand for? Option A, new patient only. Option B, nothing by mouth. Option C, normal pulse only. Option D, nighttime position order. The correct answer is option B, nothing by mouth. Explanation. The abbreviation comes from the Latin nil per os, meaning nothing by mouth. Question 91. What is the chemical abbreviation for oxygen? Option A, H. Option B, O2. Option C, C. Option D, N. The correct answer is option B, O2. Explanation. O2 is the chemical symbol for oxygen gas. Question 92. What does the abbreviation OB stand for? Option A, overbed. Option B, obstetrics. Option C, old body. Option D, observation. The correct answer is option B, obstetrics. Explanation. Obstetrics is the branch of medicine dealing with pregnancy and childbirth. Question 93. What does the abbreviation OOB stand for? Option A, only on bed. Option B, out of bed. Option C, observation of body. Option D, only one body. The correct answer is option B, out of bed. Explanation. Out of bed indicates the resident is allowed to be upright or in a chair. Question 94. What does the abbreviation OR stand for? Option A, oral. Option B, operating room. Option C, order. Option D, observation room. The correct answer is option B, operating room. Explanation. The operating room is where surgical procedures are performed. Question 95. What does the abbreviation OS stand for in relation to anatomy? Option A, on side. Option B, mouth. Option C, open. Option D, outside. The correct answer is option B, mouth. Explanation. OS is the Latin word for mouth. Question 96. What does the abbreviation OT stand for? Option A, oral treatment. Option B, occupational therapy. Option C, overtime. Option D, old treatment. The correct answer is option B, occupational therapy. Explanation. Occupational therapy helps residents regain independence in daily activities. Question 97. What does the abbreviation OZ stand for? Option A, ounce. Option B, ozone. Option C, order. Option D, original. The correct answer is option A, ounce. Explanation. An ounce is a unit of weight or volume. Question 98. What does the abbreviation PC stand for in timing? Option A, pre-care. Option B, after meals. Option C, pulse count. Option D, prior to care. The correct answer is option B, after meals. Explanation. The abbreviation comes from the Latin post-sidebum, meaning after meals. Question 99. What does the abbreviation PCA stand for? Option A, personal care assistant. Option B, patient-controlled analgesia. Option C, primary care associate. Option D, professional care aide. The correct answer is option B, patient-controlled analgesia. Explanation. Patient-controlled analgesia is a method of pain control that allows the patient to self-administer medication. Question 100. What does the abbreviation PED stand for? Option A, pedestrians. Option B, pediatrics. Option C, pedicures. Option D, pedals. The correct answer is option B, pediatrics. Explanation. Pediatrics is the branch of medicine dealing with infants and children. Question 101. What does the abbreviation PER stand for? Option A, prior. Option B, by or through. Option C, percent. Option D, period. The correct answer is option B, by or through. Explanation. Per is used to indicate the method of administration, such as per OS for by mouth. Question 102. What does the abbreviation PM stand for? Option A, per month. Option B, afternoon. Option C, pre-medication. Option D, pulse monitor. The correct answer is option B, afternoon. Explanation. PM refers to the hours from noon until midnight. Question 103. What does the abbreviation post-op stand for? Option A, prior to. Option B, postoperative. Option C, position. Option D, postural. The correct answer is option B, postoperative. Explanation. Postoperative refers to the period of time following a surgical procedure. Question 104. What does the abbreviation pre-op stand for? Option A, pressure. Option B, preoperative. Option C, prepare. Option D, prior. The correct answer is option B, preoperative. Explanation. Preoperative refers to the period of time before a surgical procedure. Question 105. What does the abbreviation PREP stand for? Option A, pressure. Option B, preparation. Option C, prior. Option D, preoperative. The correct answer is option B, preparation. Explanation. Preparation refers to the steps taken to get a resident ready for a procedure. Question 106. What does the abbreviation every 2 hours or every 3 hours stand for? Option A, quantity 2. Option B, every 2 hours or every 3 hours. Option C, quick twice. Option D, quiet twice. The correct answer is option B, every 2 hours or every 3 hours. Explanation. This indicates how frequently a task should be repeated throughout the day. Question 107. What does the abbreviation R stand for in temperature? Option A, right. Option B, rectal temperature. Option C, rest. Option D, respiration. The correct answer is option B, rectal temperature. Explanation. This indicates that a temperature was taken via the rectum. Question 108. What does the abbreviation R stand for in vital signs? Option A, right. Option B, respiration. Option C, rest. Option D, rectal. The correct answer is option B, respiration. Explanation. Respiration refers to the act of breathing. Question 109. What does the abbreviation RBC stand for? Option A, right blood count. Option B, red blood cell. Option C, rare blood cell. Option D, routine blood count. The correct answer is option B, red blood cell. Explanation. Red blood cells carry oxygen from the lungs to the rest of the body. Question 110. What does the abbreviation RLQ stand for? Option A, right level quantity. Option B, right lower quadrant. Option C, routine lower quantity. Option D, right level quality. The correct answer is option B, right lower quadrant. Explanation. The right lower quadrant is a specific area of the abdomen. Question 111. What does the abbreviation RO stand for? Option A, right side. Option B, rule out. Option C, rest only. Option D, routine observation. The correct answer is option B, rule out. Explanation. Rule out is used to indicate that a specific diagnosis is being investigated and eliminated. Question 112. What does the abbreviation RN stand for? Option A, regional nurse. Option B, registered nurse. Option C, routine nurse. Option D, resident nurse. The correct answer is option B, registered nurse. Explanation. A registered nurse is a licensed health professional who coordinates and manages resident care. Question 113. What does the abbreviation ROM stand for? Option A, read-only memory. Option B, range of motion. Option C, routine oral meds. Option D, right of movement. The correct answer is option B, range of motion. Explanation. Range of motion exercises keep the resident's joints flexible. Question 114. What does the abbreviation RR stand for? Option A, right rate. Option B, recovery room. Option C, rest rate. Option D, resident report. The correct answer is option B, recovery room. Explanation. The recovery room is where patients are monitored immediately after surgery. Question 115. What does the abbreviation RT stand for? Option A, rectal. Option B, right. Option C, rest. Option D, routine. The correct answer is option B, right. Explanation. This is a common shorthand for the right side. Question 116. What does the abbreviation RUQ stand for? Option A, right upper quantity. Option B, right upper quadrant. Option C, routine upper quality. Option D, right under quantity. The correct answer is option B, right upper quadrant. Explanation. The right upper quadrant is a specific area of the abdomen. Question 117. What does the abbreviation SNF stand for? Option A, safety nursing facility. Option B, skilled nursing facility. Option C, standard nursing facility. Option D, staff nursing facility. The correct answer is option B, skilled nursing facility. Explanation. A skilled nursing facility provides 24-hour nursing and rehabilitation care. Question 118. What does the abbreviation SPEC stand for? Option A, special. Option B, specimen. Option C, speech. Option D, specific. The correct answer is option B, specimen. Explanation. A specimen is a sample of tissue or body fluid used for medical testing. Question 119. What does the abbreviation SSE stand for? Option A, side-side exercise. Option B, Soapsuds enema. Option C, simple skin exam. Option D, surgical site exam. The correct answer is option B, Soapsuds enema. Explanation. A Soapsuds enema is used to relieve constipation or clear the bowel. Question 120. What does the abbreviation STAT stand for? Option A, stop. Option B, at once or immediately. Option C, stable. Option D, stage. The correct answer is option B, at once or immediately. Explanation. The abbreviation comes from the Latin statum, meaning right now. Question 121. What does the abbreviation TBSP stand for? Option A, total. Option B, tablespoon. Option C, tablet. Option D, tube. The correct answer is option B, tablespoon. Explanation. A tablespoon is a unit of volume equal to 3 teaspoons. Question 122. What does the abbreviation TLC stand for? Option A, total life care. Option B, tender loving care. Option C, today's lunch choice. Option D, true life change. The correct answer is option B, tender loving care. Explanation. Tender loving care refers to the compassionate and attentive care provided to residents. Question 123. What does the abbreviation TPR stand for? Option A, total patient recovery. Option B, temperature, pulse, and respirations. Option C, time, pressure, rate. Option D, timed patient report. The correct answer is option B, temperature, pulse, and respirations. Explanation. TPR are the 3 basic vital signs monitored in residents. Question 124. What does the abbreviation TSP stand for? Option A, total. Option B, teaspoon. Option C, tablet. Option D, tissue. The correct answer is option B, teaspoon. Explanation. A teaspoon is a unit of volume equal to approximately 5 milliliters. Question 125. What does the abbreviation VS stand for? Option A, very small. Option B, vital signs. Option C, visual survey. Option D, valuable stuff. The correct answer is option B, vital signs. Explanation. Vital signs include temperature, pulse, respirations, and blood pressure. Question 126. What does the abbreviation WBC stand for? Option A, whole body care. Option B, white blood cell. Option C, weak body condition. Option D, weight by choice. The correct answer is option B, white blood cell. Explanation. White blood cells help the body fight off infections. Question 127. What does the abbreviation WC stand for? Option A, with care. Option B, wheelchair. Option C, warm compress. Option D, water closet. The correct answer is option B, wheelchair. Explanation. A wheelchair is a chair with wheels used by people who cannot walk. Question 128. What does the abbreviation WT stand for? Option A, with. Option B, weight. Option C, weight. Option D, water. The correct answer is option B, weight. Explanation. Weight is the measurement of how heavy a person or object is. Question 129. Which of the following would you observe in a resident with low blood sugar? Option A, sweet breath odor. Option B, shakiness or trembling. Option C, dry mouth. Option D, increased urine. The correct answer is option B, shakiness or trembling. Explanation. Hypoglycemia often causes physical symptoms like tremors, sweating, and weakness. Question 130. When are residents most likely to feel the urge to have a bowel movement? Option A, before breakfast. Option B, after eating a meal. Option C, just before bed. Option D, during the night. The correct answer is option B, after eating a meal. Explanation. The gastrocolic reflex is most active following the intake of food. Question 131. What should you do before helping a resident stand after they have been lying in bed? Option A, give them a drink of water. Option B, allow time for them to adjust by sitting on the edge of the bed. Option C, ask them to count to 10. Option D, turn on all the lights. The correct answer is option B, allow time for them to adjust by sitting on the edge of the bed. Explanation. Dangling at the bedside helps prevent dizziness caused by sudden blood pressure changes. Question 132. If a resident's breathing gets faster and they feel tired while dressing, what is the first action? Option A, dress them faster to finish. Option B, tell them to keep going. Option C, stop the dressing to let them rest. Option D, call for an ambulance. The correct answer is option C, stop the dressing to let them rest. Explanation. The priority is to reduce physical exertion and allow the resident to recover. Question 133. What is the most important part of planning priorities at the start of a shift? Option A, deciding on break times. Option B, checking if residents are divided evenly. Option C, checking all assigned residents for immediate needs. Option D, looking at the activity schedule. The correct answer is option C, checking all assigned residents for immediate needs. Explanation. Identifying residents with urgent needs ensures safety and timely care. Question 134. What is the best response if a resident refuses their scheduled walk at 10 a.m.? Option A, tell them the doctor ordered it. Option B, walk a little further later. Option C, inform the nurse they are being difficult. Option D, would you prefer to walk a little later? The correct answer is option D, would you prefer to walk a little later? Explanation. Offering a different time respects the resident's right to refuse while encouraging health goals. Question 135. Which of these is a common symptom of low blood sugar? Option A, high fever. Option B, weakness. Option C, sour breath. Option D, frequent urination. The correct answer is option B, weakness. Explanation. Lack of glucose in the blood leads to a lack of energy and physical weakness. Question 136. What should you do if an alert resident wants to be alone with her visiting husband? Option A, suggest the husband take her home. Option B, tell them it is against policy. Option C, allow the resident to be alone with her spouse. Option D, stay in the room to monitor them. The correct answer is option A, suggest the husband take her home. Explanation. Residents have the right to privacy and to maintain marital relationships. Question 137. In a dark-skinned resident, what color might early skin breakdown appear? Option A, pale red. Option B, bright green. Option C, purple. Option D, white. The correct answer is option C, purple. Explanation. In residents with high melanin, tissue damage often presents as dark or purple rather than red. Question 138. Which foods are typically high in protein? Option A, pasta and rice. Option B, meat and eggs. Option C, fruits and vegetables. Option D, whole grains. The correct answer is option B, meat and eggs. Explanation. Animal products and beans are primary sources of protein needed for tissue repair. Question 139. If you measure a resident at 5 feet 4 inches but they say they are 5 feet 6 inches, what do you do? Option A, record it as 5 feet 6 inches. Option B, tell them they are shrinking. Option C, measure the resident again. Option D, ignore the measurement. The correct answer is option D, ignore the measurement. Explanation. Rechecking a measurement ensures accuracy when there is a conflict in data. Question 140. A resident with a hearing aid keeps asking you to repeat yourself. What is the first thing to check? Option A, speak louder. Option B, check if the battery was replaced recently. Option C, ask the doctor to see them. Option D, make sure the hearing aid is turned on. The correct answer is option D, make sure the hearing aid is turned on. Explanation. Always verify that the device is powered on and functioning before assuming other problems. Question 141. What is the best reason for giving frequent perineal care? Option A, to decrease sexual responses. Option B, it increases the assistant's work. Option C, it helps prevent skin breakdown. Option D, it prevents incontinence. The correct answer is option C, it helps prevent skin breakdown. Explanation. Keeping the area clean and dry prevents irritation and damage from urine and feces. Question 142. What is the first step you should take upon discovering a fire? Option A, check how fast it is spreading. Option B, remove any residents near the fire. Option C, throw a blanket on it. Option D, pull the fire alarm. The correct answer is option B, remove any residents near the fire. Explanation. The rescue step in our ACE means moving people away from immediate danger first. Question 143. How can you prevent burns to residents during meals? Option A, add ice to all coffee. Option B, wait until the food is cold to serve it. Option C, let residents know which foods and beverages are hot. Option D, make them wear heavy gloves. The correct answer is option D, make them wear heavy gloves. Explanation. Communication allows the resident to be careful and avoids accidental thermal injury. Question 144. What should you do if a resident says they are bored and the days seem to last forever? Option A, tell them your days are long too. Option B, ask about activities they have enjoyed in the past. Option C, tell them to read the schedule. Option D, ask the nurse for medicine. The correct answer is option C, tell them to read the schedule. Explanation. Finding out a resident's interests helps the team provide personalized engagement. Question 145. If a dementia resident is more confused today and needs more help, what should you do? Option A, tell them not to feel bad. Option B, check if another assistant can do it. Option C, provide extra help as needed to avoid frustration. Option D, tell them they have to do it themselves. The correct answer is option B, check if another assistant can do it. Explanation. Supporting a resident during fluctuating confusion prevents emotional distress and agitation. Question 146. If a bed rest resident cannot lift their hips for a bedpan, what should you do? Option A, turn the resident onto one side to place the pan. Option B, ask for a catheter. Option C, place a brief to collect the urine. Option D, have 3 people lift the resident. The correct answer is option B, ask for a catheter. Explanation. Rolling the resident is the safest way to place a bedpan for those with limited mobility. Question 147. A resident cannot speak and is grabbing their throat. What is the first action? Option A, give them sips of water. Option B, ask them to take a deep breath. Option C, reach around from behind to provide abdominal thrusts. Option D, pat their back. The correct answer is option B, ask them to take a deep breath. Explanation. The universal sign of choking requires immediate use of the Heimlich maneuver. Question 148. How can you best support a rehab resident who is recovering from a stroke? Option A, provide total care for them. Option B, set very high standards. Option C, help the resident focus on small accomplishments. Option D, remind them they will be happier at home. The correct answer is option C, help the resident focus on small accomplishments. Explanation. Encouraging small gains helps the resident maintain a positive outlook during recovery. Question 149. A resident who is usually alert is suddenly confused today. What do you do first? Option A, increase their fluids. Option B, report the change to the charge nurse. Option C, ask them where they think they are. Option D, ignore it as part of aging. The correct answer is option D, ignore it as part of aging. Explanation. Sudden changes in mental status can indicate a medical problem like an infection. Question 150. A resident finishes a seizure and is breathing on the floor. What is the next action? Option A, get the emergency cart. Option B, turn the resident onto her side. Option C, check if she can talk. Option D, help her back into the chair. The correct answer is option B, turn the resident onto her side. Explanation. The recovery position helps keep the airway clear and prevents aspiration of saliva. Question 151. Which action is correct for handling a catheter drainage bag while the resident is in bed? Option A, hang it higher than the bladder. Option B, use the bag markings for measurement. Option C, raise the bed as high as it goes. Option D, wear gloves when emptying the bag. The correct answer is option D, wear gloves when emptying the bag. Explanation. Standard precautions require gloves when handling any body fluid to prevent infection. Question 152. A resident wears a hand splint. What observation must be reported immediately? Option A, the splint was removed for cleaning. Option B, the fingers are cold and blue. Option C, the resident wants to take it off. Option D, the resident wants their arm moved. The correct answer is option A, the splint was removed for cleaning. Explanation. Cyanosis or cold skin indicates the splint is too tight and is cutting off blood flow. Question 153. Which of these is true about the effects of aging? Option A, aging can be reversed. Option B, incontinence is a normal part of aging. Option C, joints tend to be less flexible as a person ages. Option D, sensitivity to pain increases with age. The correct answer is option C, joints tend to be less flexible as a person ages. Explanation. The musculoskeletal system undergoes natural changes as a person grows older. Question 154. What should you report immediately for a resident in restraints? Option A, they say they don't like it. Option B, the position needs adjusting. Option C, they have suddenly become very agitated. Option D, the restraint was removed as scheduled. The correct answer is option C, they have suddenly become very agitated. Explanation. Increased agitation in a restraint is a safety emergency and can lead to injury. Question 155. Persistent coughing after each drink is a sign of what? Option A, thirst. Option B, difficulty swallowing or aspiration. Option C, a common cold. Option D, being in a hurry. The correct answer is option B, difficulty swallowing or aspiration. Explanation. Coughing during intake suggests fluids are entering the airway instead of the esophagus. Question 156. If a catheterized resident has only 50 milliliters of output in 6 hours, what is the first check? Option A, offer them more fluids. Option B, report it to the nurse. Option C, ask if they have pain. Option D, check to see if the tubing is kinked. The correct answer is option D, check to see if the tubing is kinked. Explanation. Mechanical blockages are a common and easily fixed cause of low urinary output. Question 157. How should you interact with a resident who is comatose? Option A, avoid changing their position. Option B, keep the room dark and quiet. Option C, talk to the resident while providing care. Option D, perform mouth care only once a week. The correct answer is option C, talk to the resident while providing care. Explanation. Hearing is often the last sense to remain, and residents deserve to be spoken to with respect. Question 158. If a resident cannot stand, how is height measured? Option A, adding up the length of body segments. Option B, asking the family. Option C, taking a measurement from head to heels while they are flat in bed. Option D, estimating based on their weight. The correct answer is option C, taking a measurement from head to heels while they are flat in bed. Explanation. Measuring in bed ensures an accurate height for non-ambulatory residents. Question 159. A resident has a seizure at the dining table. What is the next action after the nurse is called? Option A, guide the resident from the chair to the floor. Option B, remove other residents from the room. Option C, try to open their mouth. Option D, hold them tightly in the chair. The correct answer is option A, guide the resident from the chair to the floor. Explanation. Moving the resident to the floor prevents them from falling and allows for safe movement. Question 160. What is the best response if a resident says their food is poisoned? Option A, offer to taste it first. Option B, tell the nurse they are acting crazy. Option C, ask if there is something else they would like to eat. Option D, leave them alone until they are hungry. The correct answer is option C, ask if there is something else they would like to eat. Explanation. Offering an alternative shows respect and ensures the resident still receives nutrition. Question 161. Which of these is an example of disinfection? Option A, washing hands after toileting. Option B, wiping around a stoma. Option C, cleaning a shower chair with a chemical cleanser. Option D, washing a bath basin with soap. The correct answer is option C, cleaning a shower chair with a chemical cleanser. Explanation. Disinfection uses specific chemicals to kill pathogens on shared equipment. Question 162. Which of these is a protected right of a nursing home resident? Option A, selecting the staff for their care. Option B, having a private smoking area. Option C, making decisions about their care and treatment. Option D, having activities on the night shift. The correct answer is option C, making decisions about their care and treatment. Explanation. Autonomy and participation in the care plan are fundamental resident rights. Question 163. If you report a red area on a resident's hip, what instruction should you expect? Option A, massage the area with lotion. Option B, position the resident to avoid pressure on that area. Option C, cover it with a heavy bandage. Option D, clean it with extra soap. The correct answer is option B, position the resident to avoid pressure on that area. Explanation. Pressure relief is the primary treatment for early-stage pressure injuries. Question 164. When is it most important to check water temperature? Option A, during mouth care. Option B, soaking feet for foot care. Option C, giving a bed bath. Option D, washing your own hands. The correct answer is option B, soaking feet for foot care. Explanation. The feet are very sensitive and can be easily burned if the soak water is too hot. Question 165. Pain in the arms and jaw, along with nausea and sweating, can indicate what? Option A, indigestion. Option B, a heart attack. Option C, the flu. Option D, a skin allergy. The correct answer is option B, a heart attack. Explanation. These are classic signs of cardiac distress that require immediate emergency reporting. Question 166. What should you do if a resident is eating very little lunch? Option A, check if they were snacking earlier. Option B, ask if they would like something else to eat. Option C, tell them dinner is a long way off. Option D, check their last bowel movement. The correct answer is option B, ask if they would like something else to eat. Explanation. Providing a preferred alternative helps maintain the resident's nutritional status. Question 167. What is a safe way to prevent confused residents from accidentally leaving the building? Option A, block the exit doors with furniture. Option B, restrain the residents in chairs. Option C, place large stop signs on the doors. Option D, lock them in their rooms. The correct answer is option C, place large stop signs on the doors. Explanation. Stop signs or disguised doors are effective non-physical deterrents for elopement. Question 168. When a resident wears compression stockings, what should you observe closely? Option A, their shoe fit. Option B, the color of the resident's toes. Option C, their pulse rate. Option D, how fast they walk. The correct answer is option B, the color of the resident's toes. Explanation. Blue or white toes indicate that the stockings are too tight and are blocking circulation. Question 169. During perineal care, why is it important to change the spot on the washcloth? Option A, to save on laundry. Option B, to keep the soap from drying out. Option C, to prevent the spread of bacteria. Option D, to make the procedure faster. The correct answer is option C, to prevent the spread of bacteria. Explanation. Using a clean area of the cloth for each stroke ensures you are not moving germs back and forth. Question 170. If a resident misses breakfast because they dress slowly, what should you do? Option A, dress them yourself to make it faster. Option B, set out easier clothes. Option C, ask if there is any help they would like in the morning. Option D, tell them they can just skip breakfast. The correct answer is option C. Ask if there is any help they would like in the morning. Explanation. Providing the specific help the resident wants promotes independence and social participation. Question 171. A trash can is on fire in a resident's room. What is the first step? Option A. Put it out with water. Option B. Open the windows. Option C. Remove the resident from the room. Option D. Yell fire and state the room number. The correct answer is option C. Remove the resident from the room. Explanation. The rescue step is always first to move the vulnerable resident away from the danger. Question 172. A resident with a feeding tube pump needs a shower. What is the correct response? Option A. Disconnect the tube yourself. Option B. Protect the pump with a bag and take it in. Option C. Ask the charge nurse for assistance with the pump. Option D. Give a bed bath instead. The correct answer is option C. Ask the charge nurse for assistance with the pump. Explanation. Nursing assistants are not authorized to handle or disconnect medical pumps. Question 173. What is the normal appearance of human urine? Option A. Cloudy. Option B. Dark yellow. Option C. Clear. Option D. Strong smelling. The correct answer is option C. Clear. Explanation. Healthy urine is typically clear and straw-colored. Question 174. A resident with a history of falls is on the floor crying. What do you do first? Option A. Call for help while keeping them calm. Option B. Check for injuries while asking how they fell. Option C. Put a pillow under their head. Option D. Tell them they should have been more careful. The correct answer is option A. Call for help while keeping them calm. Explanation. Emergency protocols require a nurse's assessment before the resident is moved. Question 175. If you are walking with a resident and they fall, which of these is not an action you should take? Option A. Leave the resident on the floor and get help. Option B. Inform the nurse. Option C. Supply information for the nurse so proper documentation can be made. Option D. Keep the resident from moving until you can assess if they have injuries. The correct answer is option A. Leave the resident on the floor and get help. Explanation. Leaving a resident alone after a fall is unsafe. You must stay with them and call for help immediately. Question 176. If you smell smoke and discover a resident smoking in his room, it is best to do which of the following? Option A. Ignore the first incident but report it if it happens again. Option B. Call the family contact and ask them to deal with the issue. Option C. Have him stop and remind him of the facility policies because of the hazards it creates. Option D. Tell the resident you will allow him to finish but you are obligated to report it later. The correct answer is option C. Have him stop and remind him of the facility policies because of the hazards it creates. Explanation. Smoking in non-designated areas is a fire hazard and violates safety protocols. Question 177. A resident is supposed to have 8 ounces of juice every 2 hours. Which of these choices would be the most convenient to meet this requirement? Option A. 30 milliliter can of juice. Option B. 100 milliliter can of juice. Option C. 120 milliliter can of juice. Option D. 240 milliliter can of juice. The correct answer is option D. 240 milliliter can of juice. Explanation. Since 1 ounce equals 30 milliliters, 8 ounces is equal to 240 milliliters. Question 178. All of these might be used in dealing with contractures except which of the following? Option A. Hand roll. Option B. Repositioning. Option C. Bandaging. Option D. Physical therapy. The correct answer is option C. Bandaging. Explanation. Bandaging is used for wounds or support but does not prevent or treat the shortening of muscles known as contractures. Question 179. Hypertension is a medical term for which of the following? Option A. Tense muscles. Option B. High anxiety. Option C. Hyperactivity. Option D. High blood pressure. The correct answer is option D. High blood pressure. Explanation. Hypertension is the clinical term for blood pressure that is higher than the normal range. Question 180. To minimize the spread of bacteria and contamination, which procedure should be used for washing the perineum of a resident with a catheter? Option A. Wash from the rectum to the meatus. Option B. Wash from the rectum to the scrotum. Option C. Wash from the meatus out. Option D. Wash with peroxide. The correct answer is option C. Wash from the meatus out. Explanation. Washing from the meatus outward prevents pulling bacteria from the anal area into the urinary tract. Question 181. Which of these should not be part of the process for cleaning a resident's dentures? Option A. Patting the sink with a towel. Option B. Placing clean dentures on top of a tissue on the resident's table. Option C. Rinsing the dentures thoroughly. Option D. Washing your hands before and after. The correct answer is option B. Placing clean dentures on top of a tissue on the resident's table. Explanation. Dentures should be stored in a labeled denture cup with water to prevent drying out or contamination. Question 182. A resident claims he cannot find his dentures. As a nursing assistant, it is your responsibility to do what? Option A. Document the loss in the patient's medical record. Option B. Tell the resident that you will notify the family contact member. Option C. Ask the resident to refrain from eating until the dentures are located. Option D. Notify the supervising nurse. The correct answer is option D. Notify the supervising nurse. Explanation. Reporting missing personal items to the supervisor is the correct professional protocol. Question 183. According to recommendations from the Centers for Disease Control and Prevention, the scrubbing portion of hand washing should take how long? Option A. Any amount of time as long as you scrub until hands feel clean. Option B. 20 seconds. Option C. 60 seconds. Option D. 10 seconds. The correct answer is option B. 20 seconds. Explanation. Scrubbing for 20 seconds is the standard requirement to effectively remove pathogens. Question 184. All of these precautions should be followed when using a transfer gate belt except which of the following? Option A. Slightly rocking and pulling when using a gate belt. Option B. Never using a frayed or worn transfer gate belt. Option C. Not worrying about proper body mechanics. Option D. Placing transfer belts around the resident's waist. The correct answer is option C. Not worrying about proper body mechanics. Explanation. Proper body mechanics must always be used to protect both the staff and the resident from injury. Question 185. Which of these is considered an accurate method for counting respiration rate? Option A. The resident counts to 60 while the nursing assistant counts respirations. Option B. The assistant watches the chest while the nurse times 60 seconds. Option C. The resident counts out loud while the nursing assistant counts. Option D. The nursing assistant looks at the resident's chest and a watch at the same time. The correct answer is option D. The nursing assistant looks at the resident's chest and a watch at the same time. Explanation. Simultaneous observation of the chest and a timepiece ensures an accurate count for 1 full minute. Question 186. The medical term tetraplegia, meaning paralysis of all 4 extremities, is often used interchangeably with which term? Option A. Paraplegia. Option B. Hemiplegia. Option C. Cardioplegia. Option D. Quadriplegia. The correct answer is option D. Quadriplegia. Explanation. Quadriplegia and tetraplegia both describe the loss of function in all 4 limbs and the torso. Question 187. Which of these is not true when taking a blood pressure reading? Option A. Blood pressure readings can be a little higher in the mornings. Option B. The optimum position is sitting with both feet on the floor. Option C. It is best if the resident does not talk while the reading is being taken. Option D. The optimum position is lying down with the feet elevated. The correct answer is option D. The optimum position is lying down with the feet elevated. Explanation. Lying with feet elevated is not the standard position for an accurate routine blood pressure reading. Question 188. A resident has dizziness, feeling faint, blood pressure below 90/60 and cold, sweaty skin. The resident is most likely suffering from what? Option A. Hypodermia. Option B. Hypoglottis. Option C. Hypertension. Option D. Hypotension. The correct answer is option D. Hypotension. Explanation. Hypotension is the medical term for low blood pressure, which can cause fainting and dizziness. Question 189. Hypotension is low blood pressure. Which of these symptoms is associated with it? Option A. High levels of excitement. Option B. Absence of a pulse. Option C. Sudden confusion. Option D. Dizziness, lightheadedness, and nausea. The correct answer is option D. Dizziness, lightheadedness, and nausea. Explanation. Low blood pressure often causes a lack of oxygen to the brain, leading to dizziness. Question 190. Alcohol-based hand cleanser is appropriate for all of these situations except which of the following? Option A. After walking a resident down the hall. Option B. After handling a resident's clothes. Option C. When hands have observable dirt. Option D. When soap and water are not available. The correct answer is option C. When hands have observable dirt. Explanation. If hands are visibly soiled, soap and water must be used instead of alcohol-based sanitizers. Question 191. Which of these is not true about the proper procedure for taking a tympanic membrane temperature? Option A. Use a speculum cover that is twisted securely in place. Option B. Be sure that the speculum fits snugly by pulling gently on the ear. Option C. Wait for the unit to signal before removing the speculum. Option D. Be sure the ear is free of earwax before inserting the unit. The correct answer is option D. Be sure the ear is free of earwax before inserting the unit. Explanation. While excessive wax can affect a reading, the assistant does not perform wax removal before a temperature check. Question 192. If a clean nightshirt falls to the ground before you get started, it is best to do what? Option A. Ask the resident if they want to use the dropped shirt. Option B. Tell the resident to wear the shirt until you find another. Option C. Place the shirt on the chair and go get a clean garment. Option D. Put the shirt in the hamper for cleaning and get another clean garment. The correct answer is option D. Put the shirt in the hamper for cleaning and get another clean garment. Explanation. Once a clean item touches the floor, it is considered contaminated and must be laundered. Question 193. Convulsions are most commonly associated with which of the following? Option A. A muscle sprain. Option B. A seizure. Option C. A muscle spasm. Option D. A ligament tear. The correct answer is option B. A seizure. Explanation. Seizures are often characterized by involuntary muscle contractions known as convulsions. Question 194. When muscle tissues shorten and then a joint becomes hard to move, it is called what? Option A. A rupture. Option B. A perforation. Option C. A twitch. Option D. A contracture. The correct answer is option D. A contracture. Explanation. Contractures occur when muscles or tendons shorten due to lack of movement, locking a joint in place. Question 195. To obtain the most accurate resident weight, the nursing assistant should weigh the resident when? Option A. At the same time every day. Option B. 3 to 4 hours after eating. Option C. With 2 different scales to be sure. Option D. Directly after a large meal. The correct answer is option A. At the same time every day. Explanation. Weighing at the same time daily minimizes variables like food intake and fluid shifts. Question 196. A nursing assistant is instructed to take the oral temperature of a patient who just had a cold drink. When should it be taken? Option A. 15 minutes after the drink was finished. Option B. 3 to 5 minutes after the drink was finished. Option C. Immediately, because cold drinks do not affect digital thermometers. Option D. 75 minutes after the drink was finished. The correct answer is option A. 15 minutes after the drink was finished. Explanation. Waiting at least 15 minutes allows the mouth temperature to return to its normal baseline. Question 197. A nursing assistant caring for a resident with an antibiotic-resistant infection is wearing a gown and gloves. Where should she dispose of them? Option A. In the current patient's room. Option B. Continue wearing equipment to the next room. Option C. In the hallway trash can. Option D. In the next patient's room before touching that patient. The correct answer is option A. In the current patient's room. Explanation. Personal protective equipment must be removed before leaving the contaminated environment. Question 198. What is another term for a decubitus ulcer? Option A. Ulcerated cyst. Option B. Perforation. Option C. Ulcerated tumor. Option D. Pressure sore. The correct answer is option D. Pressure sore. Explanation. Pressure sores, decubitus ulcers, and pressure injuries are all terms for skin breakdown from pressure. Question 199. When monitoring a client's temperature, which thermometer will provide the least accurate reading? Option A. Axillary. Option B. Tympanic. Option C. Oral. Option D. Rectal. The correct answer is option A. Axillary. Explanation. The axillary site is the least accurate because it measures external skin temperature. Question 200. When transferring a resident from a wheelchair to a stationary chair, where should the nursing assistant stand? Option A. To the left of the side of the wheelchair. Option B. To the right side of the wheelchair. Option C. In front of the wheelchair. Option D. Behind the wheelchair. The correct answer is option C. In front of the wheelchair. Explanation. Standing in front of the resident allows the assistant to provide support and stability during the pivot.